sure if you knew this, but May is International Foot Health Month. And besides that, at some point through this month, everyone will have slipped on some open-toe shoes. And then it's about those bare feet and toes and, of course, bunions. Joining us this evening is a well-known podiatrist around town, Dr. Hartley Miltchin. Welcome to What She Said.
It's nice to be back once again. Thank you.
Almost everyone, including me, has some foot issue, and many of us suffer from bunions because we abused our feet when we were young. How common are bunions?
They're extremely common. I would say probably 80% of the population, men and women.
Men too?
Men. And in fact, last year, we did more men's bunions than I've ever done in my career. So it's becoming more prominent in men. So it's not really the shoes that cause it. It's an imbalance in the way we stand and walk that creates it. Yes, high heels will aggravate the problem, make them occur faster. But we are seeing men and women equally.
Well, Hartley, we know they're unsightly. I mean, they're ugly as sin. Mine are anyway. But are they dangerous for us?
They're not dangerous. They're painful. And most people would have their bunions removed because of the pain. But with the onset and popularity of cosmetic surgery, many people want their feet to look pretty, and they want it done for the cosmetic reasons. They're embarrassed to show their feet, whether it's in a flip-flop, in a sandal, on the beach. They're just embarrassed.
What exactly is a bunion?
A bunion is a misalignment of the big toe joint. So it happens over a number of years because of the way we walk and stand. We're not walking, standing optimally. We have a mechanical imbalance. So the bones shift out of place. Quite often you'll see people with this huge bump behind their big toe joint, and the big toe tends to drift towards the smaller toes. And they can become very painful, very red, very swollen. And like I said, many people, both men and women, are embarrassed of them.
So what's the tissue made up of? What is it?
It's bone.
It's bone.
The bone goes out of alignment. It shifts.
Okay, so what's the surgical procedure? You're going to tell us about your lunchtime procedure, but what would, if you had surgery to remove them, what would that entail?
Well, they're both surgical procedures, but there's what I call the traditional or hospital procedure, which I was trained in originally, but I saw outside the box. So you'd go into the hospital, general anesthesia, which has its own set of risks, long incisions, stitches, metal implements like screws, wires, pins, staples put in, and you're off your feet for 3-4 months.
Whoa.
In our busy lives, no matter what we do, we don't have 3-4 months to be off our feet. We just can't. The pain is very intense. So medicine is going towards what we call minimally invasive surgery, doing things through small incisions because it's less traumatic. You heal faster, there's less risk, etc.
So tell us about your new lunchtime procedure. Is it approved?
I've been doing it for a very long time. What I do is, instead of using general anesthesia, I'll just use freezing, much like if you were having dental work done, which is far safer. Instead of a long incision, I make 3 very tiny pokes. I don't even use stitches. That's how small they are. And I've adopted very small precision dental instruments to remove the bunion. And I don't shave. I make cuts in the bone and realign the bone. And I don't put any metals in like pins, wires, screws, staples. I put a bandage on, give you a special shoe to wear. And you're walking the whole time. So you don't have to miss work. If you're looking after small children, you can still chase after them.
So, Hartley, essentially, are you doing the same thing or are you doing a different procedure with the same result?
I'm making the same cuts to realign the bone, but the procedure's night and day. So it's far less traumatic most of my patients, if they have pain, instead of taking narcotics, I don't prescribe narcotics, would take what they would normally take for a headache. And the pain is usually, if they have pain, it's usually for 2-3 days, and then it just eases up, and every week gets easier.
Well, I have no pain, for example, but I have these huge bulbous bunions.
They're not huge.
Yes, they are. Because I'm looking down at them, so I'm telling you that they are, and they're hideous.
We will post a picture of Christine's feet.
Oh, no, people have seen enough of my bunions in my flip-flop shots. But are you going to get rid of that big bulb thing?
Yes.
In 20 minutes, he says.
In 20 minutes, you're going to get rid of all that? That's
Yes.
the size of a small baby.
Yours are so, we've discussed this for years. Yours are so mild. I see these huge, enormous bunions. And what the end result is, we eliminate the bump that you see behind the big toe, and we also straighten the big toe so that it's not pushing all the others towards the side.
So does that mean I get to go out and buy brand new shoes because my Bunion bought shoes won't fit anymore?
You're going to go out of flip-flops into Christian Louboutin.
Okay. All right.
And she lives just near there, too, near the store. So you actually use something as well. I don't know how you say this, the specialized handheld
Fluoroscope.
Which was developed for NASA scientists to check for cracks in the fuselage of the space shuttle, but you're looking at it for cracks in bone, or making sure that you're in the right place to make the cuts in the bone?
What I do is critics will say it's blind surgery. I can't see what I'm doing because I'm not making a large incision, opening it up and looking. But I do everything through tactile sense. I can feel everything, and I've been doing it long enough to know. But if I want to check, I have this fluoroscope, which is a handheld device. I hold it up to the foot, and I can actually see through the foot, much like an X-ray can, but this is live. So even if somebody moves the joint, I can see it happening live in front of my eyes, and I can check and make the accuracy of my cuts.
Let me ask you, if you had this procedure done, is this something that then somebody 5 years later might have to have done again if they haven't taken the precautions to have their feet properly aligned or buy the right shoes or whatever?
That's a very good question. Most people believe that they do return, but there's a picture. With the procedure, we eliminate the symptom, but the cause, as I mentioned earlier, is the mechanics of how the feet work. What I do, somewhere down the line, usually around the 12-week mark, I will cast individuals for prescription orthotics, which aligns their feet into more mechanically sound structure. Doing that, the chances of it ever returning are minimal.
And what about a client like me who would say, forget the orthotics, I'll just wear the shoes I love and I'll come back and get it done again?
Well, we can be proactive and get you in the orthotics, and then we'll never have to do a procedure.
No, I'd rather do the procedure than wear orthotics.
Orthotics, no, Christine, orthotics are like the little inserts now. They're
but I'm going to wear flip-flops. I love flip-flops.
Well, as we just mentioned, if you continue to wear flip-flops all the time, I don't mind if you wear flip-flops if you're going out for dinner. You're not going to be walking. But if you're going to go to C&E, Wonderland, walk in New York,
then
I want you wearing orthotics and proper shoes. And then we can safeguard you.
Okay.
But are you going to fix her? If I drive her to your clinic for one lunch hour and drop her off, you promise that you can fix this?
I can.
There you go. You see?
And I'll be able to come out of there and walk.
You will walk out on your own 2 feet. In fact, if you go on the website, you can actually see a young lady from the time of consultation till when she was all done with it, and it explains it all. It's a wonderful – it was a TV show, actually.
See, the last time we talked about this, I didn't really believe it, and I was afraid. So you're going to hold my hand.
I'm going to hold your hand. I'll take you there. And the website is accentonfeet.com. .com.
Correct.
Right? And that's
This
Dr.
is some-
Hartley Miltchin. Yeah, you're on a promise, Christine.
Every
I'm
bit-
going to drive.
And then,
I'm
and then I'm
going
going to come back, and then I'm going to
you.
tell everybody, and then you're going to have to, get new digs because everybody be lined up because everybody hates their bunions, and everybody I know complains about them.
Well, everybody's afraid, so that's not unusual. And that's why I see these huge, massive bunions, because they're afraid.
Dr. Miltchin, thank you so much for joining us this evening.
Thank you so much for having me once again.
This is What She Said. Stay with us.